Blood pressure refers to the force your blood places against the walls of your arteries, as your heart pumps it to deliver oxygen and nutrients throughout the body. When arteries become stiff or narrowed, that force rises beyond healthy levels. Over time, this can increase the risk of heart attack, stroke, kidney failure, and vision problems. While medications may lower the numbers, they do not always address the root causes that gradually contribute to long-term hypertension. This content is informative in nature and seeks to explain frequently ignored factors that contribute to elevated blood pressure. Always talk to a healthcare professional before changing your diet or starting supplements. Small changes in daily habits often produce significant effects on cardiovascular health, especially when carried out with constancy and attention to the body's general balance. One frequently overlooked cause of high blood pressure is dehydration. When the body lacks adequate fluids, blood volume decreases. To compensate, the kidneys activate hormonal responses that narrow the arteries and increase sodium retention, raising blood pressure. Staying properly hydrated helps support healthy circulation. Most adults benefit from drinking around 8 cups, about 2 liters, of water per day, keeping in mind that alcohol, excessive caffeine, and heavy sweating can accelerate fluid loss. Another important factor is potassium deficiency. Many people focus on reducing salt intake once they learn they have high blood pressure, but they may not realize that low potassium intake can be equally problematic. Potassium works alongside sodium to regulate fluid balance within cells. When levels are insufficient, the body tends to retain more fluid, increasing strain on the heart and blood vessels and contributing to persistently elevated blood pressure. A large portion of Americans consume too few leafy green vegetables, which are among the richest natural sources of potassium. While bananas are often considered the go-to option, there are lower sugar and more nutrient-dense choices such as spinach, kale, and avocados. Adjusting your diet to include more mineral-rich whole foods is a key step in restoring electrolyte balance and supporting proper arterial function, leading to better blood pressure control over time. Chronic stress also plays a major role. When the body releases excessive amounts of cortisol and adrenaline, the nervous system remains in a constant state of alert. This can cause blood vessel constriction, muscle tension, and difficulty relaxing. Poor sleep and high intake of stimulants may worsen the issue. Improving sleep quality, cutting back on caffeine, and ensuring adequate intake of nutrients like magnesium and B vitamins may help support natural hormonal balance. The modern American diet, often high in ultra-processed foods, added sugars, and refined grains, can promote chronic inflammation. Over time, inflammation damages the inner lining of the arteries. The body attempts to repair these areas by forming plaque, which makes vessels narrower and less flexible. Replacing processed foods with whole options such as lean meats, fish, eggs, vegetables, seeds, and extra virgin olive oil can help preserve vascular elasticity. Excess abdominal fat, commonly referred to as visceral fat, can also affect blood pressure. This type of fat releases inflammatory substances that reduce arterial flexibility. Additionally, carrying extra weight increases the workload on the heart and kidneys. Dietary improvements, regular physical activity, and reducing refined carbohydrate intake can help decrease visceral fat and gradually improve blood pressure levels. In summary, high blood pressure may be linked to dehydration, mineral deficiencies, chronic stress, an inflammatory diet, excess calcium intake, and abdominal fat. By addressing these root contributors through consistent lifestyle adjustments, it is possible to support more natural and sustainable cardiovascular health. Ongoing medical guidance is essential to evaluate individual needs and develop safe strategies aimed at long-term balance and prevention of future complications.